Namaskar, I am Dr. Manaan Gandhi from Dr. Gandhi's Ayurveda clinic, and today I want to share a topic very close to my heart. I want to talk about asthma. Asthma is not the disease that you actually think it is. A lot of times when a patient comes to me, or even when a patient goes to a doctor, the first question that they would ask is, why am I suffering from this disease? Most of the time, the answer that is being provided to the patient is nothing to do with the question that was presented. I'll give you a very simple example. If a patient comes and asks me, why am I having trouble breathing? Why is there so much problem on exertion? The doctor would tell them that there is narrowing of the tubes that is resulting in the airflow being restricted, and that narrowing is resulting in difficulty of breath, which is why to open these narrow tubes you need to dilate them, for which you need to use a bronchodilator puff, and this disease is called asthma. Have they really answered the question why? Or have they merely shown you how the problem is? What is the difference? When I talk about a why, we're talking about the root cause of the problem. But when we're talking about how, we're simply talking about the processes that happen, not the cause. So if I were to treat the how, or if I were to treat the process, I will only end up with temporary relief and not with a cure. And this is the perfect example to understand asthma. In Ayurveda, unlike homeopathy, unlike allopathy, unlike any other pathy that I have heard or known of, asthma starts from the gut and not from the chest or any other respiratory systems. When there is indigestion or kapha in the stomach, the peristaltic movement gets affected. The peristaltic movement is the downward movement of circular muscles of the intestines. When that gets affected, it causes something called as antiperistalsis or reflux. This leads to a lot of gas being thrown up, which it should not have been. It is the opposite direction of where this gas should go. And because it gets thrown up, it starts accumulating in the lungs and starts drying up the lungs by pushing the mucus into the sinuses. So most of these asthmatic patients, if they try to remember the origin, probably suffered from some sort of sinus or a cold problem where the mucus was shifted up. Now mucus is responsible for the elasticity. For example, if I were to take a leaf of a plant, right? It's very bendy, it's elastic. But if I were to keep it in a book for a few weeks, and then if I were to remove it, not anymore. A little bend and it will break. It's no longer able to bend. It's no longer able to stretch. Similarly, whenever your lungs get dry, they're no longer able to stretch. They're not able to take that much amount of air. And which is why you need to take a bronchodilator to dilate it. However, that is not solving anything. It's just a quick fix. It's a relief. Why is your lung dry in the first place? Is because of this vata moving upwards. So when we treat asthma, what we are doing here is we are actually treating two things at once. The first and foremost is we are treating the root cause, which is we are treating the stomach, we are treating the gut, so that more vata is not being produced and more problems do not increase, because that eventually is the root cause. However, due to asthma, there must have been a lot of dryness that has already crept into the lungs, so we also need to lubricate and treat the lungs, which again gives relief. So cure and relief in Ayurveda, especially with asthma, will go hand in hand, where we will work on both things simultaneously, which is why in Ayurveda asthma is one of the most successful things that we've been able to treat. And with God's grace, I have also won a national level award for the same. So this is something, as I said, is very close to my heart, and especially pediatric asthma. That means that young kids or suffering from asthma and they're not able to play in the gardens, they're not able to do a lot of things, we can really help out with this. But the only way we can is to understand the why and not get distracted with merely the how, because the how, as I said, is just a quick fix if you do not address the why. And to all my allopathic, homeopathic, etc. friends, please consider this. Try to treat the stomach as well, and I'm sure you'll get better success. This is Dr. Manaan Gandhi. I'd like to request you all to like, subscribe, share these videos, and you could ask me or tell me anything, whether you agree, disagree, you have anything that you would like to add. Write it down in the comment section. You can yell at me directly there as well. I'll try to be there as much as I can. Thank you.